and gentlemen. On behalf of the Integrated Health and Wellbeing Council, I welcome all of you to the final episode of our Diabetes Awareness Series, which is an initiative of the IHW Council and powered by Boehringer Ingelheim. The Think Beyond Sugar campaign has been organized to commemorate World Diabetes Day, a global awareness campaign on diabetes that is held annually on 14th of November. This year, the theme was Know Your Risk, Know Your Response. So to create relevant awareness on the preventive aspect, on lifestyle modifications, and more importantly, for effective diabetes management, we curated these 10 strategic roundtables wherein experts from different parts of the country came together to create awareness on diabetes management and the various aspects related with the disease. When an individual has diabetes, it requires a lifestyle change. If changes aren't made, if medical intervention is not sought, then it can lead to other health conditions. So to discuss about diabetes and comorbidities, let me take this opportunity to welcome our very esteemed guests for today. So I have with me Dr. Banshi Sabu, who's the chairman, Dia Care, Diabetes Care and Hormone Clinic, Ahmedabad. Welcome to the discussion, sir, and thanks for joining us.
Thank you. Thank you very much for inviting me.
Thank you, sir. I'm also joined by Dr. Murli Krishnan V, who's the Additional Chief Medical Superintendent and Physician at Railway Hospital, Palakkad. Welcome to the discussion, sir.
Thank you.
So we'll start with the basic questions, sir. When we talk about diabetes in India, and everyone is knowing that the numbers are increasing in India. So when we talk about risk factors, what would you, count as the most important risk factors? Dr. Banshi, coming to you.
Yes. So as you are saying very rightly, that number of persons with diabetes is increasing. One of the most common reason is increasing our central obesity. So it is overall obesity where fat is getting deposited, that is visceral obesity. And that is, the easiest marker is you can measure the abdominal girth. And the data shows that above the age of 40, almost 75% of urban female and 60% of adult male above the age of 40 at present, they have central obesity. The recently ICMR INDIAB study had shown that in India, when we have 101 million people with diabetes, with 136 people with pre-diabetes, but you will be surprised that it is 326 million people, adult people, have central obesity. So you can understand it's almost like every second person in India, adult person, is having actually central obesity in our country. And that is the reason, one of the most common reason I can say is for increasing prevalence of type 2 diabetes. Now, why some central obesity is increasing? It is because of our sedentary lifestyle. It is because of our prolonged sitting. Our behavior had become like sitting behavior is very common. We are not very physically active when we are working. That is one of the commonest reason. And the second is definitely increasing the calorie intake, because overall calorie consumption in our country is increasing. That's sugar consumption, simple sugar, simple carbs, more of fried fats, fat. These all are increasing in our quantity, in our consumption, and that is the reason for increasing our central obesity.
Banshi, very rightly, Dr. Banshi, you have pointed out how that shift in lifestyle is, one primary factor that is leading to obesity and diabetes.
This year World Diabetes Day theme is Know Your Risk. And this the simplest way of knowing your risk is, you just measure your abdominal girth. More than 90 centimeter for male, more than 80 centimeter for female, or more than half of your height, you are at the risk. So the first World Diabetes Day theme is Know Your Risk. So this is the easiest way to knowing your risk. Diabetes India had initiated a national program, and last month of November, we have, doing a lot of activities, just knowing your risk. And we have created a dedicated app also. Now that app is an Indian Diabetes Risk Score. So, you can calculate complete your risk. And if you are at higher risk, you can check your sugar, and that is also free of charge with multiple camps which we have organized. Plus, If your sugar is still normal, know your response. I mean, now what are the things which you are going to do to prevent your diabetes? That's the primary idea of doing this, know your risk and know your response on this World Diabetes Day theme. So simplest way is measure your abdominal girth. If it is higher than 80 or 90, you are at the risk of developing diabetes. Not only for the risk of diabetes, even also at the risk of developing heart disease too.
Right, right, which we will be further touching when we talk about comorbidities further down the session. Coming to you, Dr. Murli, Dr. Banshi very rightly pointed out about how obesity is a major risk factor and how we are, moving towards a sedentary lifestyle. So when we talk about lifestyle, do you think this shift towards the modern lifestyle is one of the major factors, because everyone is in a hurry, and junk food, packaged food, that the whole shift, the whole discourse has shifted towards the modern ways of living. So do you find a connection there?
Yes, definitely. Am I audible? Yeah. Yeah. This Dr. Banshi is very rightly, he has actually put it in a nutshell, because there has been a sudden increase, like serendipitously, just test for something else, the patient turns out to be diabetic. And we have studied that family history is one of the most important things. Even with no family history, people are ending up being diabetic. And what we see in this eating pattern, people are taking more of empty calories, fast food. That is one of the main things. They don't have time for their traditional cooking or for the traditional food. Then the stress, the hormones, counter-regulatory hormones, corticosteroid, all these things. It is multifactorial, definitely. But one of the main reasons, which I also think is the main thing, is, and as he has said, the central obesity is definitely increasing. And a lot of people, we see this redistribution of fat. And this is the Indian phenotype, and this pattern of high triglycerides, low HDL, all these things. It is basically a dietary and lifestyle related thing. People not getting enough time, or they are not able to manage their life and take proper food, take proper exercise, and
So,
sleep.
Murli, I just want to ask you that, how
Yes,
many railway employees are now at the higher risk of developing diabetes? Have you done any study that, whether that one particular department, the Railways Department of India, which is having highest number of people working? So,
yes.
do you have any data to show it or to
Yeah,
support?
actually, there was a problem was we were not systematically organized. Actually, very recently, railway we have computerized. For the past 6-8 months only, we are actually making our data
Because
uniform.
it
So
is
we are,
more easier where the third
yes,
party treatment is there. I mean, you are 100% reimbursing them for their treatment, so you know all the
yes,
data. So the anthropometrically, like a person's in a private practice, sometimes he comes to me, sometimes he goes to other doctors, so even you are not able
yes,
to track them. But those who are with the railways or with SBI or with ONGC or with the third party, they are continuously followed up. You are the one who give them treatment. And I think from railway or any third party company who is giving them free treatment, if we aggressively work for them to prevent diabetes itself, then those who develop diabetes, aggressively treating them and preventing their complication, actually we are going to save a lot of amount for the railway, or that matter maybe ONGC or any other company, because you are educating them for a prevention. That's what the employee can be prevented from getting the problem also. So the obesity where you can work for the diabetes treatment and diabetes prevention. I'll be very happy, Murli, if anytime we can get connected. And
yes,
I am the secretary for Diabetes India, and I'm the past president of RSSDI and Obesity Society, and we can work
yes.
together for if we can work for railway or by any other matter or by ONGC or any other company for that. Yes, Bajit, sorry.
Thank you very much. Thank you very much. I mean, actually, I was going to ask about that, because we are very much in need for organizing this data uniformly. Because we had a Public Health Foundation of India meeting a few years back, and we had collected some data, but that was not proper.
So
We
I
need
have
some help.
worked also with PHFI closely,
Yes.
but this is the area where we can work together. I mean,
Thank you
all
so
railway
much. We're
doctors
looking
also.
forward to it.
Right.
Yes, Dr. Veljit.
So that would be a very, very for the general public, it will be a very good initiative, sir. So coming back to diabetes management, when we talk about, Dr. Banshi, when we talk about comorbidities, because, if you have diabetes, you are prone to certain, heart conditions, high blood pressure. Then, of course, there are other, related problems that may arise because of that. So, what is, because there is a lot of, individuals have, since Dr. Murli also talked about follow-ups, people coming, and follow-ups are important. But in India, we have this myth that एक बार insulin शुरू कर दी तो आपको lifelong खानी पड़ती है. And so follow-up is one thing which is important, which is the gap there, because when you don't get that medical intervention and follow that, there might be complications. So what is your take on that?
So first, I will say that any persons who is having hyperglycemia or diabetes, our primary aim is not just to control his sugar. Sugar control is one aspect of it. It is like you are controlling the sugar because for that primarily he had come, or you call it a diabetic patient. But diabetic patients are prone to develop the heart problem, kidney problem, which is cardio-renal, and the stroke also, the paralysis. That is, these are the three. So now our approach is not just sugar control, glucose centric. Our approach is complication preventive approach. So first and foremost thing, if any person comes to you, the other coexistent condition which person may have, like he may have hypertension, he may have dyslipidemia, he may have central obesity, he may have thyroid problems. So these are the first thing which one have to see. Then he may already have some existing problem, like his heart may be weak, he may have already heart disease, he may have already a persons with some kidney issues. So that is what you have, other comorbidity. Now, depending on the coexistent condition and comorbidity, we start the therapy, because that coexistent condition or comorbidity should not further progress. That is number one. So you use the medication which will help, like weight reduction. It will help for your cholesterol to get under control. You have to use the molecules which will control the blood pressure also. If there is already micro and macroalbuminuria is there for kidney failure, the further progression for kidney failure should be halted. So I mean, all these are very, very important when you are trying to create a modification for all cardiovascular risk factors. These are major risk factors which one can have. If suppose they have already existent disease, suppose heart failure is already there, they have already heart attack, they have already a multiple risk factors for cardiovascular disease, he may develop anytime. So you have to treat those conditions also to prevent, because we have to want to give him a long life and a quality life. So this is what our important part is, not just giving a medication to control the sugar. So now complete shift, it's a paradigm shift, you can say, for controlling diabetic patients. So treating diabetic patients, we were having approach only to control glucose. Now we have a glucose control plus complication preventive approach. That is what we are doing. The third aspect, which is very important now, not only these two, it is the obesity, which is also to be controlled in all persons with diabetes, because obesity and NAFLD, which is the non-alcoholic fatty liver disease, which is very coexistent with the persons with diabetes, obesity, and NAFLD. So that also we want to do, because even after a very good control of sugar and the medication which you are going to give for heart disease prevention, still they are more prone to develop CVD. So unless you decrease the weight, it will not happen. So the diet control and exercise is very, very important. Now, this is a common myth amongst the people who are getting treatment for diabetes. They feel that डॉक्टर साहब यदि ले ही रहे हैं दवा तो एक आधी और गोली ज्यादा ले लेंगे, आधी गोली और ले लेंगे, थोड़ा इंसुलिन और ले लेंगे, आप खाने के लिए इतना मना क्यों कर रहे हो? Why you are saying so much restriction you are putting me on, that this you can't eat, this you can't eat, you have to go for regular walk, you have to do muscle exercise. They are very important. So why we are saying that? They are more important. This lifestyle modification is much more important. Only controlling sugar by medication is not good, because we want to prevent you from the complication, right? You have to unmute. Yes.
Yeah, very rightly you have pointed out how, the whole outcome, quality of life of the patient is very important, and that shift towards, preventing of complications in the patient, further. Coming to you, Dr. Murli, you touched upon stress, that stress is also an important risk factor. So when we talk about stress as a risk factor, how can, when you are looking at patients, counseling them, how do you manage that risk factor, and how can individuals proactively work towards managing stress?
Yes, it is actually there is a very good what we are observing, and there is actually a lot of evidence also to say that stress is an important factor, and we are seeing this for example, patients who are in a for our population, like people who are like engine drivers, what we call loco pilots, they are developing diabetes after some time, and they are developing hypertension. And the problem is, for safety reasons, if they are taking any drug other than metformin, they cannot continue the same category. They'll have to be changed. So we have to have more sessions for these people. Actually, we are actually sensitizing our administration. So these people have to be given special sessions. And many people, there are a lot of myths surrounding all these things. People don't realize that there's a lot of false information going around. So they tend to rely more on that because it suits their convenience. So we have to, these group discussions, we are planning for that, where people are already taking treatment, they can talk to these people. And for stress, definitely we need to intervene. Like we have to discuss with the patient, but that again calls for a question of time. So we need a multidisciplinary team. It will be difficult for a physician alone in our kind of setup. But nowadays, the situation is improving in the railways. And if you ask from my side, we are spending some more time. We are getting more, more doctors are joining, and people are more sensitive. There's so much of academic programs going on related to diabetes. Everybody is aware of diabetes, and we are educating the patients about stress. Then, of course, if it is very problematic, then we may need to intervene some medications like alprazolam for a short-term thing. But mostly, it will be definitely counseling and people adjusting to their lifestyle.
Yes. Dr. Banshi, coming to you.
Stress is very, very common. I mean, you can't say that someone will not have a stress because it's a very competitive life. I mean, you and me who are sitting here just now having stress because of time, because of some other engagement which you may have. So stress is very common with everyone. How you enjoy that stressful life, that's very important. So I always tell that whatever you are doing in your life, you should enjoy that. Suppose if I will have to sit here between 7 to 8 and there is no option for it, so there is no point of keeping stress that what I will be doing after 8 o'clock, or somebody may say. So that's a very important lifestyle which we have to follow. The second thing is we Indians are very stressful by nature, that at a time we do 2, 3 activities together. Like suppose you are sitting and somebody is listening us, the simultaneously they are also thinking something else in their mind, because the next program, what they are going to do, when they are going to see the movie, when they are going to eat, what they are going to do. So multiple things which we do, and multiple task itself is a reason for increasing your stress level. So I always say to my patients, one thing, do the work that you enjoy. So suppose I will have to work from 8 a.m. or is somebody who is a railway employee and he has to work for an overnight in train, he has to work. So enjoy that work. That's number one. Second, at a time you do one thing. Don't do multiple things. So when you are doing exercise, enjoy that exercise. If you are listening, you listen. If you are singing, you do it like that. That's number one. Multiple work is not good. Your basal pulse rate is also giving the idea that how much stress you have, that you can also know from that. Some of the personality which may have some psychiatric issue, and psychologist is required many times, so that can also help our patients to get the stress. But how you reassure your patient, how you talk to your patient, that will also decrease. But some of the people have stress of disease itself, like diabetes itself is a distressful condition, or when you tell them now you have a heart problem, you have a kidney problem, that also become distressful for them. So that also, how you modify, how you talk to them, how you reassure, that is the disease stress condition is also condition. Now stress increases sugar, there is no doubt about it. It increases hyperglycemia. So definitely by talking, by reassuring, by sending them to psychologists, by psychiatrists, by giving them some anti-stress treatment, definitely it is going to help to our patients. But more it requires lectures, more it requires a awareness that you can manage. Everyone is in a stress condition. I mean, because we all are in a world where very competition is very, very high.
That's true, Dr. Banshi. And when we talk about the other day, we had a discussion about diabetes in children. So the stress there also was a major reason, because as you said, competitive world, exams, K marks, every age has their own stress when we talk about that. coming back to, like you said, awareness creation is very important, and it is like catch them young is the month. So you think when we go to, awareness reaches the school especially, and when children are taught about the different aspects of diabetes management, obesity, how they need to, engage in physical exercises, you think that level of awareness creation can play a very positive role in future, especially when we talk about youngsters?
So the complete idea of this World Diabetes Day Awareness Month is that we create a lot of activities. It's not just for the diabetes, it's overall to make people healthy, the metabolically healthy rather, because it's those who are unhealthy, they are also at the risk of developing diabetes. So diabetes is a disease. If you are preventing diabetes, it means you are preventing all other problems also, like heart disease, obesity, all other problems, dyslipidemia. So we do a lot of programs, not just a screening program. It requires more of a educational program, more of a health awareness program, and inviting the primary care physicians in these programs. So the doctors are also very important. Your healthcare professional who are educated, dietitian, nutritionist, nursing staff, they are also very important. And sometimes doing a program in a public area, like day before yesterday, I was doing in a club where 300 people were there. Sometimes we do in the garden where 300, 400 persons are there. Sometimes people invite us. So there are, Lions Club, Rotary Club, they keep on inviting the doctors for doing camps. I always say the camp has no value. I mean, doing a sugar for 1,000 people, and out of them, 800 are not going to have the sugar, they feel they are more healthy. It's not like this. If someone does not have sugar high, it does not mean he's healthy. He may be at the risk, and that's the reason we developed that this score should be calculated on an app. So if you are at the risk, you should be given an intervention. You should be given an education. So always all these type of camps program should have a education program. When I go to small town and these Rotary and Lions people, and they keep on inviting, sometimes Sarpanch, local MLA, all these in periphery area, you give talk, you give educational awareness talk only. There's no need to do the only camp, because camp is not going to give any answer. It is the education which is important. In school also, we give the talk, but normally I try to, when school invites us, I tell them, okay, you invite me on a parent day. So they have there are children and parents, both are there. And that time, a 15, 20 minutes, 30 minutes talk is really useful, because whatever you tell to the children, they may not understand fully. So, if their parents are there for their dietary lifestyle modification, for their activity, and the school teacher should be also there, because they can change the stress can be decreased to these children, and giving them more time to play. All these things are very, very important. So these are some of the tips which I want to tell always to my colleagues, that you do all these activity, which will increase the awareness in the society if we really want to prevent diabetes and other metabolic conditions.
I would just like to thank you very much, because we are having a lot of camps, and I think I'll include this risk score in our camps, and try to include some sessions also.
Yes. So
Because
Murali,
you are
if
very
you
correct.
send
It's
me
a very good.
your number just now in chat box, I'm sending you my number.
Yes,
So I
definitely.
will include you, and I will send you that how you can join these camps also.
Yeah,
Yes.
sure.
So, Dr. Banshi, very rightly, you have talked about how awareness creation is important. And of course, diet management. And so, Dr. Murli, coming to you, when we talk about dietary recommendations, so, and you talked about how counseling, and Dr. Banshi also gave an example how patients say that, अरे हमें दवा बढ़ा दीजिए खाने पे हम, because in India there are a lot of, I have seen people saying हमारी डायबिटीज क्यों बढ़ी है, हम तो मीठा खाते नहीं है. So this is this mental blockade that only sweets can give you a high, so when we talk about counseling on dietary recommendations, how is that ensured, and especially with caregivers, or because women of the family manage the food and everything, so how is that ensured, like how do you do that?
Yes, that's a very important question actually. Often it happens that even during our inpatient rounds, we go on increasing the insulin levels. And one of the junior doctors took rounds, and he was telling me, this guy is paying the attendant and getting extra food from outside. So then we realized that all the education that we were given them. So then I started concentrating on the bystanders, that is the patients, even in the OPD. Especially if they're little older people, like you was talking about children, the parents. Same thing happens to adults also. Some people, they just you see that they're not buying what you're telling them. So you have to take special care about the diet. I mean, all these drugs, I mean, like whatever you do, you just go on increasing, you're adding insulin, you're adding GLP-1, and then in our case, we have to get a lot of flack from the administration because they see that you're going on spending so much on drugs, but results are not seen. So much better results can be obtained if you can educate the patient about the proper food, proper way to take insulin, proper way to take diet, proper exercise. These things are really important. Diet, especially, there are a lot of myths regarding diet. It is basically, as you rightly said, the women of the because still the women are doing the cooking, so they have to be educated regarding calorific value of foods. How our traditional diet itself can be modified in such a way that people don't develop. Okay, the calorie can be divided between carbohydrate food and some simple charts like the plate method. These things can be incorporated in the patient education. So our only problem was this time thing because we had a very crowded thing and we were little understaffed until recently. But then we realized, like what was initially discussed in this thing, prevention is much better because if you can prevent diabetes, you can prevent the railway from losing an important person in the top notch because he's been trained for so long. Just because of diabetes, he cannot work as a driver alone. So that is a very it was very eye opening. The time invested in educating people is definitely worth it. You can prevent morbidity and mortality.
Right, Dr. Banshi, coming to you, since Dr. Murli also talked about a traditional diet. So, do you think when we talk about a preventive aspect, which the government is also, now talking about how preventing should be the mantra and not, going there and seeking treatment. So, when we talk about preventive lifestyle, you think our traditional way of living, traditional way of eating, physical work, then of course yoga and things like millet is being, promoted by the government. So do you think these are some of the initiatives which can, if we talk about going back to basics, to our traditional way?
I agree with you that it is going to help, but actually speaking, to be very frank, the government is trying, but it is not up to the mark. Second thing, you can't think of completely changing the lifestyle in 21st century. You can't go back in 19th century what you were doing and suddenly overnight you are telling the people that one side you are going to give them a lot of gadgets and the environment which is really diabetogenic and obesogenic environment which is there just by changing the millets, but it is the overall calorie content, it's overall quantity, how much you are taking, giving them more of a public transport. I mean, the people who are traveling in a public transport in compared to those who are traveling on your own scooter or bike or your car, they are found to be more obese. So this is the data which is there. Now you can't say somebody is staying in 10-story building and you will say that you will not be allowed to use the lift. That's not going to be possible. So I mean, some things are there, but what government can do, creating more activities, like creating more park, creating more activities where they can go and play, more gardens, all these things. And more important is creating awareness for all these things. Like we are creating awareness, तंबाकू नहीं खाना है, दारू नहीं पीनी है, आपने ऐसे सब, we put advertisement, such type of advertisement when you go to in the movie also. Similarly, these type of advertisement also related to health also can be put on this. It may be on public transport, in buses, in metros, in train, in local trains, like you are saying about the smoking. Similarly, the more sitting is like equivalent to smoking, or increasing your obesity increases the risk for all these diabetes. This is the simple messages which can be there. It can be also used by your phone also. You can tell the BI, or you can tell all the Geo and all these company also to send these healthy messages on regular basis. That is also possible. So there are something public private partnership can be done, and it can increase the awareness, because sometimes people say that I want to go to my school on every day on cycle, but there is no cycle track which is available in my city. Or the people who wants to transport themselves by, I will go by on my own bicycle to my office, I don't feel it's okay, but there's no dedicated track, I know where I should bicycle it. So some systems government has to create, by which we can definitely prevent this problem. Government is trying definitely hard, but primarily we have so many acute problems. Like at present, if you talk about kidney failure, a lot of people are in kidney failure. They are on dialysis. Railway is also having trouble that they need transplant for these people. Then there is a heart disease people, and then there is angioplasty and bypass is going on. Nobody talk that how we can prevent all these problems. Even our insurance system is also like this. Your Mediclaim, like someone who is remaining healthy, like suppose if I am keeping myself fully healthy, my insurance amount annual, it should be less in compared to somebody who is remaining unhealthy. He's smoker, he's sedentary, he's increasing in weight, he's not doing any exercise. So we have to make some system like that. We should give you more benefit directly. Suppose my insurance of 10 lakhs rupees is costing me every year 50,000 rupees, but I'm keeping my body more fit. So the chances of getting hospitalization to me is less in compared to someone else. So my insurance company should give me the more benefit, or either I should be given a less amount I should pay for my insurance. So something like some systems we have to create where people with are healthy, they should give benefit. The similarly, even in public, private, or in the companies also, normally on a seniority basis we give promotion. Somebody is 45. Now, instead of a 40, he will be given the promotion because he needed. He's in service last 20 years, or on the basis of your educational qualification. Now, I think one more thing we should add in that promotion is your health. So, like suppose someone who is at a senior level and he has to go in a management level. If he is not healthy, that 1/3 mark should be cut. So now you are not the right person. Even you have education qualification, which is more, or even you are senior, but because you are not maintaining your health, that should not be also promoted. So somewhere we have to give indirect and direct benefit to the healthy people. So that's the reason the people will become more healthy. You are finding some companies who is CEO, who is managing director with 120 kg. What type of message he is giving to the society? Sometime a person at the 100 kg and then he's a chain smoker and all the time smoking, and you can see that. So what type of message which we are giving to the society? I think, and even the same thing which happens with police also, and sometimes we see the people who are in public service. So even the doctors also, I'm not saying only that this, blaming the doctors also. If they are not healthy, how they can give the best service to the patient? So few things we have to change. Some government policy has to be changed. I am not saying that government is not doing, but they must be doing, and they are doing a lot of activities, but I think we need more.
There are gaps that need to be addressed, and there are bottlenecks, because when we talk about a preventive lifestyle, awareness is very important. Coming to you, Dr. Murli, if we talk about bottlenecks, or what are some of the gaps,
How much time it will continue? Because I have some other meeting also. I'm sorry for that.
Sir, we have planned it for 1 hour.
Okay. If you can reduce it to 10 minutes, the next 5-10 minutes.
So I'll first come to you, Dr. Banshif. When we talk about diabetes management, and personalized care based on, because this is not a one size fits all approach kind of a thing, that, when we talk about the holistic well-being of an individual, and of course, like you pointed out, quality of life. So what are the major considerations, when we talk about those personalized management plans?
We now moved from a guideline-based therapy, which was previously that everyone should be treated with this disease in this guideline form. So there was a guideline format, then it had become very individualized. So from guideline, you have to find out that this person will fit in this. We call it also, again, then it becomes a personalized medicine. And in personalized, also very precision medicine. So suppose I want to give an XYZ with this is the therapy which as per his personality, but whether still his disease will be treated by this particular precisely medication which I am going to use, like some of the genetic test and some of the things which you can do. So complete medicine system has moved from guideline based therapy or a blanket therapy for everyone. It is now very much individualized, it is very much personalized, and it is very much precise also for that particular person to get the best of the best treatment. And that's the reason there has to be a one-to-one consultation. You cannot have a consultation for masses. You can't have a medication can be given only by medical shop, because many of the patients in India, the other problem which government can do for preventing all these problems or increasing the compliance for patients, the medicine which is prescribed by the doctor, patient continue to take that medication from medical store or pharmacist without refilling his prescription. So that's a big problem for non-communicable disease. Somebody who has started lipid lowering agent today, even his lipids are not controlled, he's continue to take it, or he may take the in matter aspirin or some of the other medication which may be harmful also, or it may not give the benefit also because you have not uptitrated, or there is a new medication which had come and still the person is buying and taking the old medicine. So these are some of the things which is to be done. So it has to be very, very personalized and very precise also for the person to whom you are treating.
Dr. Banshi, but one last question. When we talk about awareness creation, what would be your 5 major tips? You can address those myths that people have associated with diabetes. For our audience, what 5 takeaways would you give
So the
them?
5 takeaways, you are talking about the myths for diabetes, or you are
Myths
talking
or
about five
anything
takeaways?
that you as an expert know that people have this kind of a blockade, myths or
So
anything.
one myth and commonly which I want to tell everyone, that diabetes is a preventable disorder. Many of our patients who are first time diagnosed, they come and they complain that my father was having diabetes or my grandparents were having diabetes. That's the reason I'm having diabetes. But they don't understand that diabetes can be prevented. Your father was having diabetes. That does not mean you are going to have diabetes. So for all those listeners who have a strong family history, please try to understand that diabetes and heart disease can be prevented. Go and meet your doctor how it can be done. That's number one. Second, maintain your good health. One of the easiest ways, maintain your waistline, maintain your abdominal guard. That is the second most important thing. Third thing is, do at one time, I mean whatever work which you are doing, and that's called meditation. Meditation is pranayam, meditation is your yoga, meditation is your dancing, meditation is your cycling, meditation is your running, meditation is your any sports activity, because these are the activity. Or even meditation is bhagwan ka naam, bhajan le rahe ho, bhajan ga rahe ho. That is also meditation, because if you are doing any such activities, that will not allow you to do second activity simultaneously. If you are running, you have to run only, because at that time if you are thinking something else, you will fall. So these all are meditation activity. Third thing is, nitya 3 minute dodi. At a minimum you should run for 3 minutes, like 30 minutes of walk plus 3 minutes of running. That will give you a good aerobic activity, plus doing muscle strengthening exercise, doing abdominal exercise, doing some yoga, stretching and pranayam. So this is almost like a package deal of 60 minutes per day exercise or 80 minutes of the exercise. That is what required. And the last, very important, sleep. De-stress yourself, detox yourself from all these computers, social media for some time, at least in a day, and smile. So that's the mantra to remain happy, stress-free, and having less. And whatever you are, you enjoy that life. Don't be under stress. You may be doing whatever number of hours you have to work, but you enjoy that work also.
Dr. Banshi, conscious living is very important in that.
Thank you.
Thanks for being with us, and thanks for taking out time. And I'm sure the audience just took away a lot of relevant tips, and your insights will inspire them to move towards a preventive lifestyle. Thanks for being with us.
Thank you, Murli. I will send you the message also. Bye-bye.
Thank you. Thank you.
Thank you. So coming to you, Dr. Murli, as my earlier question was, because Dr. Banshi also talked about there are gaps, that need to be filled. So coming from a public background, how would you say that what are the major bottlenecks when we talk about management or even awareness creation, behavior of, that behavioral change that needs to be done? What will be your, when we talk about challenges?
Yeah. So actually, I would like to quote from something that we have learned in our preventive medicine, because I learned it from my own experience. I am not diabetic, but I have hypertension. So I just wanted to, I found that this is very, very applicable. When we were learning, we did not understand. When I started practicing medicine and it came to my own experience, I understood something called the KAP. Whenever I asked to give a talk on diabetes, I usually include this thing at the end of the thing. It is called knowledge, attitude, and practice. It is something that has been well recognized in preventive medicine to bring about any behavior change in a person. So first is the knowledge. You have to know that there is a disease like this and it has affected you. Second is your attitude towards it. Because I knew that I had a family history of hypertension. I'm just quoting my own example. Because even after being educated, this is how the human mind works. Like he was telling, Dr. Sau was telling about, it's not possible to suddenly bring people to a new traditional diet. I mean, you are sitting in front of the television, you order a pizza and eat. I mean, you just tell them, go and cook, stop. It's not going to work. Like that, your attitude is very, very important. You may have a lot of knowledge, but I knew I was hypertensive, but I didn't bother about it. I didn't even bother to check it. Then I found out, okay, now, no, I have to start because it took some time. Then the next thing was practice. When I started practicing again, I started missing the pills. So I used to forget. I was busy. Then I knew it's my own responsibility. Then I bought a pill box, which was a very simple solution. So the biggest bottleneck is in these three places: knowledge, attitude, and practice. For the common man, you can imagine how much more difficult it is. First, you have to protect him from all this wrong information that is circulating for different vested interest groups. Like lot of I don't I'm not against traditional things or anything, but there are certain basic facts like proper calorie restriction, proper exercise, sleep, all these things. These things, then if you're not able to do it, if you're taking some traditional medicine, your sugar is controlled. So you teach him about self-monitoring of blood glucose. The patient has to decide for himself that his diabetes is controlled. First, he has to have the knowledge about diabetes. He has to understand that he has to treat his diabetes. Then he has to bring about behavior changes at lifestyle, at home, at his workplace, de-stress himself. So it is basically something just like, because I finally found out that this love of food, especially carbohydrate food, is something as bad as alcohol. It is like an impulse control disorder. So just like you have Alcoholics Anonymous for alcoholics, you need a support group where diabetic people come and sit and work out their own. Where there should be a diabetes educator, there should be a doctor who's supervising the session, but it is the time spent to change the attitude of people. And in this group, you should bring the people at high risk because prevention can, as you said, no, diabetes reversal is being well studied. We have so much data. That is your beta cells are not undergoing apoptosis. They are undergoing quiescence. They are getting de-differentiated. With your control of the lifestyle and glycemic control, glucotoxicity, you can reverse this whole thing. So this epidemic of availability of so much of energy, so much of free energy, so much of sedentary lifestyle, this entire thing, if you want to change it, is basically a behavior change. So that is what is important if you take lifestyle, if you take diet, or if you take exercise, or the stress control. Everything is the body and mind and how the people react to it. So you need to spend time, you have as a group, and you have to decide. Uh, and the patients have to decide that they have to take up this in a serious way. Then they can avoid morbidity because you can actually show them people with nephropathy, with renal failure. What happens? There are people who are that level of ignorance is there. So when people sit and talk together, they will understand this is an important problem. They have to address it, which I think is going on in many places. I think many endocrinologists, many diabetologists are doing groups, and at our level, we are also planning. Actually, many of our doctors are started doing this. They made WhatsApp groups where people discuss, and I am planning to do that myself because we had a session in our railway where we different specialists from all over Southern Railway came and discussed at Trichinopoli. We discussed the problems related to diabetes, and we shared a lot of information. So this is what I would like to suggest.
Right, Dr. Mundi, very rightly you have pointed out that awareness is important. And when we talk about awareness, and of course, early detection. So many people, according to many surveys, if a random sampling is done of blood sugars, many people were not even aware of the fact that the level is high. So what are some of the early signs that people should look for, before they go for that detection?
Yeah. the early signs of diabetes is notoriously a very silent disease, maybe not as silent as hypertension, but it is quite a silent disease. It may not have any symptoms at all. So if you are at risk of diabetes, like you have got a family history of diabetes, definitely after the age of 30, you have to start, even now, even earlier, you can start checking at least once a year. And the other thing is if you are getting obese, definitely. Then the classical symptoms that I mentioned in the textbooks, polyuria, there have been a few patients who actually complained of these things. We are taught that they're very uncommon, but it can happen. That is, you can be passing a lot of urine, increase urine frequency at night. You're getting up to pass urine, increase thirst, or increase hunger. You are taking more food than normal. Then recurrent infections, fungal infections. These are all some of the clues. And if you're getting dark spots, what is not acanthosis, if you're there in your armpits, if you're getting darkening of the skin, or if you're under the chest, and especially if you're getting striae, these are all signs that you are having skin tags. There are small skin tags. These are all things that you are having insulin resistance. And if you have definitely, if you have got any other disease like coronary artery disease, or if you had a stroke, definitely the doctor will now, nobody, you will be doing a fasting, a postnatal blood sugar, and an HbA1c, and definitely you will be screened for diabetes because it is being increasingly recognized. So that is not a problem. But the other people who are not aware, these would be some of the pointers to show that you have to test yourself for diabetes. But mostly for any person who is above 40, it is good to check at least once once a year at least. If you're not a high risk person for fasting and postnatal blood sugar.
Right, Dr. Murli. Now, since we have talked about how, you yourself said that, technology is being, and Dr. Banshi also pointed out about how, we have become more prone to gadgets and technology. And of course, you talked about how there is a lot of misinformation also through different channels. But do you think somewhere down the line, technology has also, ensured that with a smartwatch at the tip of their finger, people can now readily check their basic vitals? So do you think technology can play a positive role in that sense when we talk about early detection, yeah, move towards a preventive lifestyle? Can technology play an important role to accelerate that change towards moving towards a preventive lifestyle?
Definitely, technology is definitely a boon because I myself I'm a big fan of these new developments, especially as you have said, our heart rate monitors. We have been using in our ICU so many monitors. Like ICU care is nothing like what when we were students. Like it's been more than 20 years since I finished my MD. I can't imagine these things going that time. And now these tools, see, they're the two sides for everything. It depends on you what you take and what you don't take, and especially these apps, these monitoring apps. The simple thing, what we were talking about, sitting. These new apps have got this. They monitor how long you're sitting, so your watch can remind you. So if a person is educated, then the first thing to tell him if he wants to make a lifestyle, I would suggest is to get a smartwatch because that will help. You need a mentor. You don't need to go and spend lakhs of rupees to go join a gym. You can do your own daily exercise. You increase your walking. Like we were told by endocrinologists when we went for a physicians conference. Our endocrinologist, you people are physicians. We are walking around the whole hospital treating patients. You people are. It is very correct. He said, you get rid of your attender. You have any paper or any work to be done. You go and do it yourself. See to it that you stand up. Now you got a watch that is reminding you. You've been sitting. It happens. Actually, it happens. My watch tells me you've been sitting. You better stand up and walk around for some time because our lifestyle is like that. So technology is unbelievable. Technology, it is limitless, and it is visual reminders. Like a graph can show you how your glycemic control has been if you can feed your CGM. And CGM, continuous glucose monitoring. See, one of our staff had diabetes. Our nurse, she was unwilling to accept. I did a continuous glucose monitoring for her. I showed her the graph. She saw the spikes. Then she realized. So technology is, I mean, it is something wonderful and something that has really helped the medical department. Like it is something that all people should understand and utilize. It's a beautiful thing. Like this meeting itself is the effect of technology. Previously, I would have had to come to your place for this meeting.
Yes.
This is wonderful. I can sit in my home and do it.
Yes, that is very true. So when we talk about the younger generation, what would be your, tips to them? Because when we talk about packaged food, and there is this myth that I already talked about that, only sugary food can, though we don't cover packaged food in that with so much of preservatives, salt, sugar, which at the end of the day is a major thing. So if you had to give 5 tips to the younger generation on how to effectively manage their lifestyle to prevent such conditions, what would that be?
See, one thing I would like to say in praise of the younger generation. See, they are addicted to technology, to video games, to junk food, but they listen. They have got this very good plasticity. They have got, if you talk sense to them, they understand. They may take time. The same KIP thing I told you. They have knowledge. Their attitude will change and they will practice. But you have to catch them young. So you can talk to them about small things. Like the first thing to tell them would be like, you do not make tremendous changes. You have to, but you have to be wise. Like I like this. What this dietitian say? This 80%, 20%. Okay, 20% of the time you cheat. You go for junk food. It's that all addicts do that because food is an addiction. As I said, it's impossible to say. If you tell somebody don't eat, he's going to go for depression. This is not going to happen. Also, he'll stop seeing you. That's what's going to happen. So you tell these people, okay, you can do, but practice for your own sake. Second thing would be to educate them, like what is diabetes? Ask them to find out. And the third thing is to their own people. If there is somebody who is diabetic, they can see their lifestyle. You can show them the complications because whenever there's an elderly person with diabetes, I always ask the young people to come because they are tech savvy. They control the older people, and when these people say, the others listen. So I find them as a very and then the next thing would be technology. You can show them, you can guide them with the correct articles, the correct groups to listen to, and to detect false information when they see it. And about exercise, I think all of them are they are all aware of their looks, and if you need not train them much on that. Many of them are back to cycling. Many of them are walk to jogging. They are the only thing is they need to get away from the negative effects of their other groups, and then be put on the right track. But once they're on the track, I think I'm quite optimistic about.
Coming back to diabetes and comorbidities, Dr. Murli, since most of what Dr. Banshi talked about, how you can have kidney, chronic kidney diseases, then of course coming to cardiovascular risks and an n number of, because it is said that diabetes impacts your overall body, all the organs, eyes are not even spared. So when we talk about the long-term complications, so if you have to discuss about that with the patient, and proper counseling has to be ensured to give him an overview of what might happen if medical intervention is not, taken care of. So how would you describe those long-term complications in a precise manner?
Now, I would like to. I actually tell many of my educated patients also that diabetes is a disease with the blood vessels. So the final thing, why are we bothered about this high blood sugar? You have got certain chemicals that will slow down the blood flow to many of your vital organs. So all organs are dependent on. It can affect any organ. Like previously, syphilis was known as a great mass. It could affect any organ. Syphilis is no longer seen. Now they're saying diabetes has taken over the role of. So it's a protein manifestations. There's multiple manifestations. So, we have got 3 organs that are affected by what is known as microangiopathy. That would be your retina, your nerves, and your kidneys, the small vessels. So in kidneys, you will have initially hyperfiltration. Your urine will become frothy if there is proteinuria, and then you will develop renal failure. You will get edema. The other thing would be the nerves, where you will get tingling and numbness, which you need not educate the patient. The patients always complain. The earliest sign of tingling, they will come to you. And vision, that can go undetected for a long time. So it is imperative at diagnosis they have a vision checkup. So these things definitely have to be educated to the patient on. These are the complications of microangiopathy. Macroangiopathy affects the heart, the brain, and that is a big blood vessels. The heart, the brain, and the lower limb vessels. So the patient will have what is known as claudication. When he walks for some time, he develops severe pain in the calf muscles. He has to stop walking for some time. That shows that the blood flow to the legs has come down. And the other thing would be exertional angina. That is when the patient walks, he has got a heart pain in the heart. But that can also be not there. In a diabetic patient, he can be unaware of the patient problem that he's got impaired cardiac blood supply. And the other thing would be a stroke. That is, he can have a sudden attack of not being able to speak, or even going for a complete paralysis. So once you tell these complications to people who are unaware, they will understand that this diabetes is something to be reckoned with. You have to take it quite seriously. You have to take lifestyle modification as well as drugs quite seriously. And I'm able to convince many people to take insulin also, because I tell them that the best treatment with such HbA1c would be to prevent your complications and check your regular HbA1c. These things are, as I said, it's just the time. Sometimes we may not have time to explain all these things. But during multiple interviews, we tell them about these things, and they also understand.
Dr. Murli, that this brings us to the end of our discussion, and thanks for being with us. Any message that you would want to give to our audience on related to diabetes and how to move towards the preventive lifestyle? A short message, any tip to proactively manage, what would that be?
Thank you very much. My only tip would be to be aware. The awareness of what causes diabetes. It is a disease of, as Dr. Banshi rightly said at the beginning, it is a disease basically of calorie excess. Our lifestyle, we are putting in too much and putting out too little. It is just this balance. Be aware of what you're eating, how much you're exercising. And then if you are diabetic, then you keep track of your blood sugar. And again, this lifestyle is the first thing. The fact that you're taking drugs doesn't mean the lifestyle is the basic foundation on which it is never too late. Without that, there is no point in drugs or insulin. They can't work because you're simply. There was an analogy. There was an analogy where you are filling in a gunny bag with excess of things. It is bursting. Your system is bursting. So you have to control your calorie intake. So that is a very good analogy. If you remember that every time you eat, it helps you. That, especially for obese people, that will help them to insulin versus your cells are just saying, I don't want anymore. This is all that is in there. It's just calorie excess. And your obesity is your best example. Of course, there are other types of diabetes we have always been discussing about. We are discussing about type 2 diabetes. There are different forms of diabetes. Just stress that because this is the epidemic. This is people without family history, no risk factors, they are developing diabetes because this is an epidemic. If controlled, will definitely go miles in making society safer.
Yes.
Thank you so much for inviting.
Thank you, Dr. Murli, and thank you, Dr. Banshi, Dr. Murli, for being with us. And I'm sure that, our audience took away a lot of relevant messages from today's discussion. As a person with diabetes, it is important to fully follow the plan that is given by healthcare provider to ensure that you prevent any long-term complication. At the same time, moving towards a good lifestyle, calorie intake are some of the things that need to be managed effectively. Thank you, Dr. Murli, for being with us. So with that message, we come to the end of the series, and thanks to our partner, Boehringer Ingelheim, for the Think Beyond Sugar campaign. Please follow our social media for more updated information. Thank you.
Thank you.